Section, and Raghavendra sir, our student branch coordinator. As part of the continuous efforts to curb the spread of the COVID-19 pandemic, vaccines are a critical tool in the battle against COVID-19, and getting vaccinated is one of the best ways to protect ourselves and others from COVID-19. Many people are excited to have vaccines as the first step in managing the spread of coronavirus. Unfortunately, there has been a little of misinformation spreading the vaccines and the development. When deciding whether to get the vaccine, it's important to separate myths from facts. Our speaker in today's session will be providing us with the proper information regarding this. Now, I would like Sharanya, our IEEE member, to introduce our speaker for today's session. Over to you, Sharanya.
Thank you, Aniket. Good evening, all. It is both an honor and a privilege to be able to introduce you to a role model of note, a man of distinction, Mr. Srihari Seshadari, PhD, MBBS, MPH. Dr. Seshadari currently serves as team lead for Regulatory Investigations Office, Immunization Healthcare Division, Defense Health Agency, Falls Church, VA. In his current position, he is involved with multiple vaccine safety effectiveness studies. Dr. Seshadri completed medical school in India and serves as a physician overseas. Upon completion of Masters in Public Health, he joined Barron River District Health Department, Bowling Green, KY, as Regional Epidemiologist. During his tenure at BRDHD, Dr. Seshadri was responsible for disease surveillance, outbreak investigation, and led the agency's multidisciplinary EpiRapid team. Dr. Seshadri had been a preceptor of master's and doctoral internship in public health as well as a host site supervisor for CDC's PHAP Associates. Dr. Seshadri, PhD in clinical and translational science and is a recipient of KPHA's Career Achievement Award. I hope you'll all agree with me when I say Dr. Seshadri is a perfect person to spread awareness about COVID-19 prevention. I request all of you to kindly turn on your videos for a snapshot of the event. Now, I request Seshadri sir to take over the session. Thank you.
We'll have a photo session and then we'll ask her to.
Can you all hear me?
Yeah, 1 minute, sir. We'll have a photo. All of you, please turn your videos.
Okay, thank you everyone.
Sir, we'll start the session.
Good evening, and in fact, we have got people in different parts of the world attending this program. So hello to everyone. And thank you very much for the introduction. And IEEE, thank you very much for inviting me to present to you today. And thanks for being a part of this program this evening. Let me see if I can share my screen.
ಅದು ಎಷ್ಟೊಂದು ದಿನ ಆಯ್ತಲ್ಲ.
Yes, sir, it's visible.
Thank you. Able to see the screen?
Yes, sir.
Okay. So before I can start this, I would like to have a disclaimer here. I am not an expert by any means in COVID disease. I would just like to share the little knowledge I have and what I've learned over the last couple of months. Before we start this program, I really take a moment to thank all the nurses. I mean, I know the Nurses' Day was last month, but between Mother's Day and Father's Day, which is Father's Day is on Sunday and Mother's Day was in May as well, I would really like to take this moment to thank every nurses out there who do a tremendous amount of work without whom we cannot really have a good outcome. So when you seek care, it's not just the doctors you need to thank the nurses, the paraclinical staff. There are a lot of people behind the scene who play a major role in your healthcare. So thanks to every one of them in what they do. So tonight we will talk multiple things over the next 50 minutes or so. These are the topics that we will cover, and we will have a question and answer session at the end. So it's the introduction to our SARS-CoV. It's a new virus because it is new. We are not immune to it. It is very contagious, spreads quickly. The only two ways to gain immunity is either vaccinate or get infected. So those are the two options we've got. So some basics about some background on this that we call incubation period. Incubation period means the time from which you get exposed to a specific disease, not specific to COVID, but any disease, the time you develop some symptoms. That's called the incubation period, which for COVID usually is around 4 to 5 days. So it does not happen just like that. It takes some time. So the range can be as early as 2 days and up to 14 days. So people have a question asking, when do you think I was infectious? When do you think I can give the disease to someone else? So they say that it's 2 days before the onset of symptoms. That's the most challenging thing with this specific disease. Even before you know that you're having COVID, you can be infectious to other people. And it usually resolves the infectious period, the infections, the capability to spread to other people minimizes by 10 to 14 days after the onset of symptoms. So the next question comes is, what's the mode of transmission? The most common mode of transmission is breathing in droplets or particles, or direct splashes and sprays, or touching eyes, nose, or mouth, especially when you've touched a contaminated surface which has COVID on it. So what can we do to prevent it? I mean, the first step, we always say, prevention is better than cure. So given that I'm a public health professional, I emphasize a lot more about prevention. And I think that's the best tool we have at this given point in time to combat this pandemic that we all are in. The 4 key things I would like to stress today is mask, social distancing, hand washing, and vaccination. So we'll talk about mask. So a common question is, what kind of mask do I have to wear? So if you're selecting a cloth mask, you want to make sure that your cloth mask has at least 2 or more layers. and it's a breathable fabric. You want to make sure you can breathe through it, okay? And make sure it completely covers your nose and your mouth, okay? And if you need to make sure that you have a right kind of mask, you can hold the mask through the light, and if it blocks the sunlight through it or light through it, then you're good. You have a good mask. So the most other important thing is to make sure that it really fits your face appropriately. Fits your face, so you're covering, there's not any gap around your face. And it should preferably have a nose wire, so you can kind of you can make it fit your face and you don't have any air leaks around your nostrils. So the big question is how to wear a mask. I mean, it sounds simple, even though we have been in this pandemic for over 15 months. Unfortunately, people yet do not know how to wear a mask. That's the unfortunate reality of this. I mean, it sounds simple, but I want to stress here that please pay close attention to the specific about how to wear your mask. The first most important thing is before you wear your mask, make sure you wash your hands and then you put your mask on, okay? And make sure the mask covers your nose, your mouth, and you secure it under your chin. Make sure it's not slipping away from your earlobes. And if you continuously have to adjust your mask, that means it's not a proper fit for you. And make sure you can breathe easily through it. We also have surgical masks, but beware, the surgical mask is single use, not to be used more than 6 to 8 hours. If the mask is wet, it's not going to function. So it's really important to make sure that you're using the mask which is not wet. So these two show you which masks not to use. I've seen people use masks made out of vinyl. Please don't use it because you cannot breathe through it. And I've also seen people use masks which have vents in them. I've seen a lot of even leading people use such kind of mask. I request you not to use such kind of a mask because these are unidirectional valves, which means you're preventing yourself getting infected, but you may be spreading things to other people. So please do not use a mask which has these kind of valves in them. Another big request to all the public is please do not use N95 masks. The reason I stress that is if you have to have proper protection from N95 masks, you have to be fit tested. When I say fit tested, yes, healthcare professionals usually who wear this N95 mask are fit tested every year to make sure that the type of N95 mask they use is appropriate for their facial features. So if you're not fit tested, these N95 masks are of no help to you. It may be better off with people who are healthcare workers who are fit tested and who need this type of mask to take care of people who are real sick with COVID. So if you're using a N95 mask and you're not fit tested, you may be better off wearing surgical mask or wearing cloth mask. So here are a few of those pictorial representation of how to wear the mask this way. I've seen a lot of pictures, a lot of people, even on television, even on interviews, that they wear the mask very inappropriately. And all the public media, I'm sure you all have seen, where the masks are like, just like the way they've shown these pictures. If you're doing it this way, it's not when you want kind of a thing. You got to make sure you wear the mask before you leave your home. Maybe this one message I want to really stress to you all is wearing your mask appropriately before you leave your home is the most important thing. It should not be an on and off thing. You should, given the kind of spread that we have right now going on in India, I think wearing your mask appropriately, consistently is the most important thing that I would request each one of you to follow. And a common question I've had from people is, what about double masking? Yes, double masking is okay, but make sure if you use a double mask, the first layer is a surgical mask and you wear a cloth mask over it. I've seen a lot of people use it other way around. No, it does not work that way. So if you plan or if you decide to use double mask, use a surgical mask first, and then you use a cloth mask over it. A common misconception which people have been doing is they're wearing two surgical masks. That's a no-no because it does not improve the fitness around your facial features. So it's not a good use of your resource and it's not going to protect you anymore. I've also seen people wear a cloth mask or a surgical mask over an N95 mask. Not a good idea either. Just wearing an N95 mask is sufficient, especially if you're fit tested. Let's see if we can watch a video about how to wear or how to use this mask. Just give me a minute. Let me make sure I can share this video with you.
There's a simple way to make your disposable mask fit better, which can make it more effective in protecting you against COVID-19. First, fold the mask from edge to edge. Then, make a knot in each ear loop. Push the knot as close to the edge of the mask as possible. Next, fold and tuck the extra material under the edges of the mask. Hold the mask up to your face and gently push the nose wire against your nose so it fits snugly. Place the ear loops around your ears as you normally would to secure the mask. Be sure to remove any gaps in the mask around your nose and cheeks for the best protection. And this is what we call knot and tuck.
Hope you were able to see that. Make sure I get back to the presentation. Okay. So, mask guidelines for children. This is given out by the Indian government, and less than 5 years should not be required to wear a mask. 6 to 11, it depends on the ability of the child to use a mask safely and appropriately under direct supervision of parents or guardians. Greater than 12 years of age or 12 years and older, they should wear a face mask just like we adults do. So, as important as it is to wear the mask appropriately, it's also important, equally important to remove your mask appropriately as well. So make sure you untie the strings behind your ears, behind your ears, and you hold the loops in your hand, and then fold the corners, and then wash your hands. Please do not touch the front portion of the mask because that's where you can expect to have a lot of contaminants. A common question I've got from people is, how do I wash my mask? If you have a cloth mask, you can either put it in your regular washing machine with your regular street clothes that you wore outside, or you could hand wash it with regular tap water and a laundry detergent or soap. Make sure you rinse it thoroughly with clean water and remove any detergent or soap. And you can use a dryer, or you can use air dryer hanging it to sunlight. So the next concept we would like to address is social distancing. It's a new word. What does it really mean? Stay 6 feet apart. That's all it really means. Avoid crowds. Please limit going into situations where there are a lot of crowds. Avoid being in poorly ventilated indoor spaces. The next point I would really make here is about traveling in a car or cab, especially if you're using a cab, or for example, if you need to go and take care of someone who probably is sick with COVID and you're trying to help them go to the hospital. The recommendation is make sure the patient or your friend who you're going to pick up and yourself, you are wearing a mask. Turn off the air conditioning unit in your vehicle, open all the windows, and the traveler, we recommend not to sit directly behind the driver. At least it's more like a diagonal, so that you're limiting the exposure within the vehicle. Hand washing is not a new concept. It's an old concept, but a very important thing. Hand washing is the most important thing, not just for prevention of COVID, but a lot other diseases. Wash with soap and water. If soap and running water is not available, you can use hand sanitizer with at least 60% alcohol. Now we will go on to talk about COVID-19 vaccines. A key point I would like to make here is it's critically important for each one of us to receive a COVID-19 vaccine. A myth is COVID vaccine causes diseases. No, vaccine does not cause COVID-19 disease. A major concern people have currently is the vaccine being rushed? Is it safe? Yes, the vaccine is safe. Vaccines go through several phases. We got preclinical phase where we test the vaccines in the animal models, non-human primate like your monkeys, chimpanzees. We test in those, and once we find they're safe, then we move to the clinical where we do it on where we administer the vaccine to humans for testing. So the phase 1 is when you have really a small group of people, healthy volunteers. We want to make sure it's safe, the vaccine works, and we don't have any side effects. Once we do a good job with phase 1, we have good outcome from phase 1. That's when we move to phase 2, where we have several hundred volunteers, and we look for most common short-term side effects. And we want to make sure that the volunteers are responding immunologically appropriately. And once we have good results from phase 2 is when we go to phase 3, where we have hundreds or thousands of volunteers to make sure the vaccine is safe, to make sure the vaccine is effective, and to understand what are the most common side effects. So most of the vaccines that are out there in the market right now are already in phase 3, or already have approval from phase 3, and a lot of the vaccines, or almost all the vaccines in usage, it has got emergency use authorization. So you go through all these different phases to make sure that the vaccine is safe. In the situation we're in right now, the phases may kind of overlap, but does not mean the safety of these vaccine studies have been compromised. Safety is the key for any vaccine development, and they make sure that the vaccines are safe. So here is what kind of different vaccines we have in the market right now. And as you see here, you probably have seen this picture several times before. This is a picture of the virus, and we got the spike protein. So that's what we all are targeting in the vaccine, the most common thing we're targeting in the vaccine. So we got spike proteins, we got the mRNA material inside the virus. So that's what they utilize for the Pfizer and Moderna vaccine. It's mRNA-based vaccine. The Johnson & Johnson vaccine, it is a non-replicating adenovirus vector-based vaccine. Covishield or AstraZeneca product that is currently used in India, it's also a non-replicating adenovirus vector-containing vaccine. Covaxin, which is again developed and manufactured in India by Bharat Biotech, is an inactivated whole SARS virus vaccine. So it has the whole virus in it, but it's inactivated. So that means it cannot cause a disease. Sputnik V, which they're talking would be introduced into the Indian market, is also a non-replicating adenovirus vaccine. The difference here is it's a 2-component vaccine, which means the dose 1 would have different components than the dose 2. So dose 1 has adenovirus vector 26, dose 2 has adenovirus vector 5. And Sputnik Light is a version of Sputnik V, which means they're just giving you the first dose of Sputnik V. Just first dose of Sputnik V is the Sputnik Light. So in this slide, we will talk about the number of doses, the interval for different vaccines, and their efficacy. So Covaxin, the number of doses recommended is 2 with 4 weeks of interval. Covishield, number of doses recommended is 2, 8 to 12 weeks. The Janssen product that is right now provided in the US, 1-dose vaccine. The mRNA Moderna product is a 2-dose vaccine given 4 weeks apart. The Pfizer product, which is also a 2-dose vaccine, it's an mRNA vaccine that is given 3 weeks apart. The Sputnik V, it's a 2-dose vaccine given between 3 weeks to 3 months, and Sputnik Light is a 1-dose vaccine. Here in this table, I have listed the different efficacies that are provided by those manufacturers at the time of their interim data analysis. This does not mean that this is current by any means. Also, I would not want you guys to compare these efficacies because these efficacies don't really mean much in the real world. So I want you all to have this in your mind and not start comparing which vaccine is better than the other, because all these vaccines have used different methodologies to determine their efficacy. So please do not compare these vaccines' efficacy. The major other factor also is the vaccine efficacy depends on multiple factors. The intensity of transmission happening at the time when the study was done, the public health measures, the variants in circulation. So right now in India, we got different strains of COVID-19 that is in circulation. So the efficacy may not be as it has been posted by the manufacturers at the time this vaccine were studied. Given that we have a lot of different variants, especially now that we have Delta variant of COVID-19, we will have breakthrough infections will happen. You can ask me the question, well, why get vaccinated? Yes, you can have breakthrough infection, but the severity of the illness or death resulting from the illness is significantly lowered. So the main intention to get the vaccination is to reduce the severity of the illness. So at this given time, we don't have any scientific studies to compare the COVID vaccines that are out in the market. So please don't start to compare and change your minds about different vaccines based on these efficacy results. So here are a few points which I would like to bring to your attention. If there is a delay in getting your second dose of vaccine, don't worry about it. There is a lot of information to be known. We really don't have a precise science to say exactly what is the time frame between 2 doses of vaccine. So these are the recommended time frame, but these are not, we don't have long-term studies done to say when exactly the second dose should be received from some of those vaccines. If there's a delay in getting your second dose of vaccine, you don't have to restart your vaccination series. There are certain situations when we request to defer getting the vaccine by 3 months. One is if you've had a recent COVID infection, we want you to recover from your COVID infection and wait for 3 months before you get your COVID vaccine. Another key point which I would like to stress here is about if you have been treated with monoclonal antibodies. You're hearing a lot about this in the media. If you have been treated with this monoclonal antibodies for COVID-19, please defer getting your vaccines for at least 3 months. And for any other disease, any other situation you had to be hospitalized or in ICU, we recommend at least waiting for 4 to 8 weeks to get your vaccine, because your body may not have good immune system at the time when you're just discharged from the hospital. And some people may be using various medications for different health conditions. Like for example, if people have arthritis, they may be put by immunosuppressive agents by their physician. So before, if you're in that kind of a situation, make sure you're giving enough time before taking the COVID vaccine and after taking the COVID vaccine. So you don't want to be immunosuppressed when you are going to get your COVID vaccine. The same thing applies to very high dose of steroids. Like some people may be on very high dose of steroids for various reasons. In those situations, you may need to stop your steroids if possible for at least a couple of weeks before you get the vaccine to make sure that you get good immune response from the vaccination. So there's a lot of discussion going on right now in media. Oh my God, the COVID shield initially said 4 weeks, then they moved on from 4 to 6 weeks, then 6 to 8 weeks, now 8 to 12 weeks. Are they just goofing around? No, there is science behind it. There is literature, the scientific studies done to show that 3 months time frame may be a better outcome for people to have time between the 2 doses of COVID shield. So facts about the COVID-19 vaccines. It prevents severe disease and death. It does not cause COVID-19 disease. It does not cause infertility. A lot of discussion is going on about that. It does not. It does not change your DNA. It can be given during menses. A lot of questions I have received over the last several months is, can I give it to my elderly father? Can I give it to my elderly family members? Yes, please do not hesitate. You can give it to elderly people. Even folks with underlying health issues, or people with asthma, or people with allergies, or people who are on blood thinners, they can get the vaccine. There is no need to hesitate to get the vaccine. So you're not considered completely protected at least 3 weeks after completion of the vaccine series. So just because you get the vaccine does not mean you can start moving around freely. No, that's not the whole idea behind it. So the only main contraindications to these vaccines is if you have any history of anaphylaxis to the contents of the vaccine. So I have listed here the contents, so you can review it to see if you have any known allergies to these contents. Then it's a contraindication. You may not want to get that specific brand of vaccine. And do not take any vaccine when you're currently sick. If you have any underlying health issues going on, like you have fever, you got cough, you're sick with something, please do not take the vaccine because your immune system may not be good enough to get good protection from the vaccine you take. So what to expect after a vaccination, right? So you will see some mild effects, usually at least for the first 48 hours. Like you may have injection site pain, low-grade fever, muscle aches, body aches, headaches. All these may be there for a day or two and then they disappear. So most of us will not have any major issues. We'll have some mild issues from the vaccine, which usually go away within 48 to 72 hours. So don't hesitate to get the vaccine. Rarely, in fact, very rarely is when you have some serious side effects. We have heard about some situations of myocarditis from the mRNA vaccines, some clotting issues from AstraZeneca and Johnson vaccine, but those are very, very, very rare. I mean, 0.06%. So that could really explain to you that the rarity of these severe side effects that you may see. So do's and don'ts after vaccination. So what do you need to do after vaccination? The first 3 or 4 days after vaccination, the key thing is to make sure you're well hydrated. So what I mean by well hydrated is take plenty of fluids. You can use paracetamol or acetaminophen for mild symptoms. Please do not use paracetamol or acetaminophen before getting the vaccine, because some people believe that if they use this as prophylaxis, the side effects will be lowered. Please do not do that. Only if you develop any kind of mild side effects from the vaccine, you can use paracetamol or acetaminophen. Just because you received vaccine does not mean you can take off these public health measures. Please continue to mask. Please maintain social distance, wash your hands, and complete your vaccination series. Don't panic, because stress brings down your immune system. And just because you got the vaccine, do not let your guards down. Vaccine is just one other tool to fight against this COVID pandemic. So let's talk about some of the symptoms, testing, and management of COVID-19. On the left, you got some of the most common symptoms, which are very non-specific, right? If you think of the symptoms, we have experienced a lot of these symptoms even before in our lives. So let me give a little synopsis of what happens. So if you get exposed to the virus, most of us may not even develop any symptoms. Some of us do. If you do, what's happening really is basically the virus goes through your respiratory tract, and it kind of infects your upper respiratory cells. So it goes and gets into your cells, multiplies there. So when it multiplies and it breaks down, that's when the first one or 2 days is when this multiplication is predominantly happening. And then by day 3, your body may say, hey, this is foreign to me. And the antibodies in your body start to attack those cells which are infected by the COVID-19 virus, right? So that's when you start to have these mild symptoms of like cough and fever and sore throat, okay? So within the first few days, 3, 4, 5 days, most of us, our symptoms get resolved because our own antibodies in our body is able to fight away these viruses. In some situations, it may not be the case. They may progress into further. So we'll talk about those in the next few slides. So we do have testing for it. The gold standard right now is the RT-PCR, but it is labor intensive, expensive, and takes at least 1 to 2 days for the results. The rapid antigen test takes about 15 to 30 minutes. However, the sensitivity is lower. What I mean by sensitivity is, say if you test 100 people who have the disease, it may show about 50 or 40 people to have positive results. So it may miss, even though you may be positive, it may miss those people. So that's one of the downside of using rapid antigen test. Generally, we would not recommend going and getting a high resolution CT scan right away. It may be ordered when if you're symptomatic yet have a negative RT-PCR, and or to manage the severity of illness or gauge the severity of illness. But just don't go right away to get a CT scan done. We may see some testing results which are negative, especially if you do it pretty early in the disease, because the viral load may not be high enough for the test to pick it up. So if you do the testing very early in this, like you just start to have a little bit of cough or a little bit of sore throat, and you just run in to get the test, and the test result is negative, it is not true negative. You may have the disease, but the test is showing you false negative. So once you have an RT-PCR that is positive, please do not repeat to see if you're going to turn in negative. No, please don't repeat your RT-PCR. Once you're positive, usually by 10 to 14 days, most of us will clear up and you will be negative, but don't repeat, don't go back and test, especially when the resources right now are limited. Okay. So in cases where the rapid test was negative, but you're symptomatic, you may want to go and get an RT-PCR done to make sure you have or you don't have. The key thing is, if you're symptomatic, please, even if you have a negative result, stay home, follow isolation, and follow treatment protocols. So just because you start to have some mild symptoms, which is like cough, cold, low-grade fever, don't panic. That's not the end of the world. Most of us, 80 to 85% people are asymptomatic or have mild disease. So most of us, this is bulk of it. I mean, what we see in media are those remaining 10 to 15%. And we pay a lot of attention to those 10 to 15% and forget that most of us may fall into this 80 to 85% who are asymptomatic or have mild disease. Let's talk about the different classifications are. Mild is when your respiratory rate is normal, you're not breathless, your oxygen saturation is greater than or equal to 94. So if you have mild symptoms, stay home. You just need home isolation and care, nothing more than that. If you're breathless or your respiratory rate is more than 24 breaths per minute, or if your oxygen saturation falls between 90 to 93%, you need to be in the hospital. If the respiratory rate is more than 30 and your oxygen saturation is less than 90% on room air, that person needs hospitalization in an ICU. So let's talk about what can we do at home for mild disease. For mild disease, you basically need to do nothing other than staying home and doing such important things. Number one is physical distancing. If you have a person who is suspect or is confirmed by lab test to have COVID, please use mask in-house. Maintain strict hand hygiene. And what you can do is monitor your temperature, maybe monitor temperature every 6 to 8 hours, document that, and use a pulse oximeter and check it and note down the reading. And then you walk briskly for about 6 minutes and recheck. If your oxygen saturation remains the same, you have no problem at all. If it falls by 4 to 5%, say your oxygen saturation when you were resting was 98 or 97, and after you had a brisk 6-minute walk, it fell to 93 or 94 or 92, that's an early indication for you to think about seeking healthcare, going to the hospital. So what can you do at home? Key thing is oral rehydration, making sure you're hydrated well. You can use commercially available products like Electrol. If you don't get them, I've heard people saying that they don't have access to it because it's all sold out. No worries, it's a simple thing that you can do it at home. Just take 6 teaspoons of sugar, half teaspoon of salt in 1 liter of water. That's all it really is. Okay? Key thing I would like to emphasize is proper nutrition. Freshly cooked food with lots of protein. That's the most important thing I would like to stress. Proper hydration, proper nutrition. If you have fever, you can take paracetamol or crocin or dolo, 1 tablet every 6 to 8 hours. If you have cold or cough-like symptoms, you can use antitussive or antihistamines like cetirizine or loratadine. Some people recommend multivitamins, steaming and gargling to help you symptomatically. You can ask the question, when do I need to seek care? You need to seek care when you have difficulty in breathing, or if you have high-grade fever that's not responding to your like dolo or crocin, or if you have severe cough and that is lasting for more than 5 days. A common question I've had people ask me is, how do I do steaming? Again, please do not do it for more than 5 minutes. You can repeat it 3 or 4 times. And the main thing I would like to stress here is you're inhaling the steam from your mouth and exhaling through your nose. A lot of people have misconception of trying to breathe in through your nose. It may be a challenge, especially if your nose is stuffed. You may want to inhale the steam through your oral cavity and then exhale it through your nose. So what can you do if you have someone who's sick with COVID at home? Okay, basically you need to be supportive to them. Watch for warning signs like I just mentioned before. Isolate the sick person. If possible, use a separate bedroom and a bathroom. I mean, especially give a person who's sick with COVID, give them a bathroom which has a window which opens to the outside. That may be preferred so you can have better air circulation. Wash utensils in hot water, wearing gloves. Do not share personal items like towels and stuff like that. Even though your household, please make sure you wear a mask to limit the spread at home. Wash your hands frequently. And as a caregiver, make sure you're tracking your own health as well. You've had a lot of questions about oxygen concentrators, especially when we've had issues with challenges with getting oxygen cylinders. People have been like buying oxygen concentrators. One thing I like to stress here is there are a lot of inappropriate oxygen concentrators out in the market. So the key thing you want to make sure is when your oxygen flow per minute is 5 to 10 liters, make sure that oxygen saturation that the machine is giving out is 90%. You've seen those machines out there, which as soon as you increase the flow per minute to 10 or 5, the oxygen saturation that's coming out of the unit drops to around 30%, which is of no use. Just like your regular oxygen saturation is about 21%. So if you have an equipment which drops to 30% when you increase the flow, that's of no use. It's just waste of your money. So that's just the reason I put this particular information out for you. So those are many of your engineers. So if you want to develop your own, oxygen concentrator, this could be a project for you guys. This is what is in an oxygen concentrator, so you can look into it. So that's the reason I put this picture out there, especially since many of you are engineers. A lot of questions recently has been happening about COVID-19 associated mucormycosis. They're being calling as black fungus. So here's some of the background on mucormycosis. It's not a new disease. It's serious but rare opportunistic fungal infection. Most fungal infections are opportunistic. What I mean to say by that is when the fungal are out there in the environment, nothing new, okay, it is there. It's an opportunistic in the sense it makes use of opportunity, especially when your immune system is down, it starts to multiply, okay? So especially this fungi is out in the environment, it's there everywhere. So every one of us exposed every single day the fungal spores, but healthy individuals will not develop mucormycosis. I don't want you to start, panicking about mucormycosis, okay? Mucormycosis does occur with people with uncontrolled diabetes if the sugar is not controlled, in cancer patients, especially if they're on chemotherapy, which brings down their immune system. If they're a recent recipient, or if they're an organ transplant person who received organ from another person, they're usually on immunosuppressive drugs. Those are the kind of people who potentially can develop mucormycosis. So if you answer yes to both sides of this particular slide is when you need to think about seeking healthcare to see out for mucormycosis. History, uncontrolled diabetes, or currently what we're dealing is history of hospitalization from moderate to severe COVID disease with any of the following, in the sense, very high dose steroids, immunomodulators, being on a ventilator, prolonged hospital stay. And if you have this history, and then you also have these associated symptoms, new onset of blockage of nose, blackish or bloody discharge from your nose, localized pain around your cheekbone, one-sided pain. That's what the ENT specialists stress about. One-sided pain or numbness or swelling on one side of your face, sudden blackish discoloration over your bridge of your nose, start to have a blurred or double vision with pain, or chest pain, coughing up blood, increased difficulty of breathing. These are some of the symptoms to think about of mucormycosis, and you need to seek immediate care. So why are we seeing mucormycosis now? We are seeing it because to manage these patients, especially those who are hospitalized, they're usually on very high dose of steroids or immunomodulators. And in these kind of people, immune system is lower. So given that this fungus is an opportunistic, it will multiply and grow in these patients. So the prevention, the key thing I would like to really stress is, especially if you are immunosuppressed, when you're going outside into areas where it's dusty sites, like construction sites and places like that, wear a mask. Those of you who are diabetic, and those of you who are not even diabetic but recently have been discharged from a hospital, please monitor your blood sugar to make sure it's well controlled. And use of antibiotics, antifungal, and steroids is something that you need to be really careful about. Unfortunately, there's a very inappropriate use of antibiotics and steroids right now. And that's one of the leading reasons why we're seeing so many mucormycosis. Please do not take antibiotics, antifungals, or steroids on your own without a doctor's recommendation. Make sure it's used appropriately at the right time. Especially if you're using humidifiers with oxygen therapy, make sure you're using clean, sterile water. Okay. One thing I would like to really stress to each one of you is, please don't combine allopathic medicine with herbal, Ayurvedic, homeopathic medicine without consulting your doctor. I'm not against any of these systems. The only reason I like to stress about is because we do not know the direct interactions between the allopathic medicines and these alternative medicines like Ayurvedic, homeopathic, or herbal remedies. That's the whole reason why I like to stress about it. A lot of concerns recently about what about after you're discharged from the hospital? What about post-COVID? Yes, people do have some issues after they've been discharged from the hospital. They can experience fatigue, in the sense tiredness. They can have some cough or some persistent cough, which may need oxygen requirement. People may be depressed. People may have some persistent headaches. Some of them have complained of migraine headaches. People can experience palpitation, chest pain. In some cases, thromboembolism, or we call what we call as deep vein thrombosis. And in some cases, chronic disease. Of course, least of our concern right now is hair loss. So these could happen, especially if these happen after 4 weeks after recovery from the COVID illness. These could be what we call as post-acute COVID syndrome. So an oath that I would request each one of you to make from this presentation is, I will mask before leaving home. I will remain masked outside home. It is not like the way you use your goggles or your helmet. Make sure once you leave your home, your mask is there on you. You're covering your nose, covering your mouth and chin. You will maintain social distance. I'll wash my hands properly and frequently. I will help and encourage others to get the vaccine. I will help and support my family and friends. So a lot of people are trying to help by donating money. That's a great thing. Also, you can help people, like for example, your neighbors, elderly people who are maybe your neighbors who may not know how to make an appointment for their vaccination. You may have people in the rural community who may not know to get an appointment for their vaccination. So, or they may not have means to go and get the vaccine, or they may not have money to get the vaccine. So you can step up and help. For example, I've had people who live in large apartment complexes. So those like maid servants who work, or the drivers, the cooks who come and help these multiple houses, you all can pitch in and get them vaccinated. Those could be some things that you all could do to make sure each one of you, it's not just about yourself, it's also about others, because we are protected only when others in our community are protected. So it is really important for us to make sure every one of us are vaccinated. Okay, so please encourage and get vaccinated. Be supportive of your friends, because sometimes all that people really need is just a phone call from you, reassuring them, saying, hey, I am there for you. Just those reassurance words go a long way. Reduce your stress, because stress reduces immunity. Do any activities that keeps you happy without harming others, whether it be meditation, whether it be yoga, whether it be reading scriptures like Veda or Bhagavad Gita or Quran or Bible, whatever scriptures you read which would make you happy, which gives you peace of mind, please do that. Any routine exercises that you have been doing before, please do that. Pranayama are good. Anything that would make you happy, do that. Stay positive, have a positive attitude, but remain COVID negative by doing these steps. Here are the resources that I've utilized for putting this presentation together. Some of the resources may also be helpful for you to review and learn if you're interested. I'm open for question and answer session.
Hear me?
Yeah.
So I have three questions. First question is about the testing. People that government has reduced the testing in order to reduce the positive rate. Is it correct?
So let me make sure I'm hearing you. Start sharing. Let's see if I can. Okay, so you can see me and hear me well? Yeah. Okay, so the question was regarding government is limiting testing. So that's a challenge that we have right now with limited supply. But again, the recommendation right now from ICMR is to get, if possible, an RT, like a rapid test. And that's more readily available at most places than the RT-PCR. So if just your first step may be to get a rapid test, and if that's positive, then you have a conclusive result. If that's negative and yet you have symptoms and you want more testing, then that's when you can go for RT-PCR. But again, if you're symptomatic, the key thing I would like to emphasize is most of us would not develop severe disease. So if you're symptomatic, stay home, follow isolation precautions, follow those basic precautions. You don't have to get all those. I mean, like I've seen a lot of people get multiple antibiotics. I mean, I've seen people, for even asymptomatic people, getting about 10 or 11 different medications. Not required. There's a lot of panic out there. Don't respond to those panics. Please stay home. Follow the basic rules of thumb, things that I've just recommended before, and that should be okay.
So there is one more question from
Sure.
Mr. Ramanujam. Thank you, Dr. Srihari, for the information. Sorry, missed your first part of the session. Could you please clarify how do we deal COVID with kids, as there is a fear of third wave in India, which can affect kids?
Yeah. So managing kids would not be any different than managing adults in one way, in the sense that all the precautions that we are taking, that like hand washing, social distancing, masking would be essential. The first thing is, if our adults stay protected, we can minimize exposure to our kids. So that's the key thing. And for kids, again, monitoring the symptoms, and if they have any like breathlessness, or the temperature is not responding to routine paracetamol or crocin, seeking care at the right time would be crucial. So the main thing is, number one, for us as adults to get protected, to minimize exposure. And when I say minimize exposure, is if you've gone, for example, if you've gone out and you've been working, or you've traveled, like when you come home, don't touch anything in the home. Don't touch your kids. Don't touch anyone else. Or don't touch any surface. Go to your restroom or bathroom. Undress. Put away those dress that you've worn outside. Wash or take a shower, and then come in. because that way you can minimize the exposure to the kids. And I think, again, there is a risk of exposure. As long as you can minimize the exposure and you get vaccinated and you mask as suggested before, we can minimize. Again, there's hopefully in the near future, there are studies being done about vaccinating children. Hopefully that will come into fruition. Like right now in the US, they're vaccinating children 12 years and over. Hopefully that will happen soon in the near future in India as well.
Sir, good evening, sir. After getting COVID, after how much duration we can take vaccination, sir?
So the recommendation is 3 months after having COVID disease. So say you had COVID disease, you recovered from it. The recommendation is to at least wait for 3 months after you have got the COVID, recovered from the COVID disease, you can get the vaccine. And then you get your regular 2-dose, or if it's a 2-dose vaccine, you get a 2-dose vaccine. If it's a 1-dose vaccine, you get a 1-dose vaccine.
How long the vaccine effective after you are fully vaccinated?
Good evening, doctor. I have a question.
Okay.
If we see the statistics in Karnataka, in Mysore and Bangalore, there are more deaths compared to other regions. If we see at like my native, which is in Uttara Kannada district, Kumta, there in my village only, every house they are infected by this corona fever. But there is absolutely no problem. Nobody, I mean, not much complexity. They are going to a doctor in the village and consuming the medicine given, general medicine for fever. So no problem at all. What could be the reason, sir? Any logical reason?
You have a very good question.
Yes,
Number one, I think, unfortunately, in the urban population, we tend to panic more. Unfortunately, sometimes we are abusing or overdoing things. Like you just said, most of us, like I just said in the earlier slide, 80 to 85% of us don't need anything. Like you just said, regular medicine for fever is all that they need. That's the reason why you're seeing good outcomes in rural areas. In urban areas, I've been seeing where people are taking like antibiotics on day one. They just had a little bit of cough and low-grade fever. They're taking antibiotic, antiviral, and steroid. No, because what's happening is, especially if you take steroid within the first 5 to 6 days of the illness, you're facilitating the multiplication of the virus. So unfortunately, in urban areas like big cities, people are just going into pharmacy and buying these things because they've seen someone else take these medications. So I would attribute some of these abuse of medication as one of the major reasons. Not taking the right medication and not taking the right medication at the right time. I mean, you don't have to start antibiotic on day one. It's of no use. You're complicating your illness. You need antibiotic and steroids only if you have progressed your illness where you've been having persistent fever and cough for more than 5 days. Those are the kind of people, or if your oxygen saturation is falling, those are the kind of people who need antibiotic and steroid. But unfortunately, with what I'm seeing or what I'm hearing from my friends and family members is people have been taking antibiotics and steroids and multiple things. I've seen prescriptions which are like have 13 different medicines. Those medicines have a lot of side effects. Many of them don't even know what medicines they're taking, and they're having a lot of side effects. So many of them are going into hospital, not because of the illness, but the medicines that they're taking in, which is really bringing down their immune system and causing a lot of illness. So, I mean, that would be one of my explanation, as well as the way things are reported in urban area is different from the way things are reported in rural areas. It may even be with regards to the way things are reported, or the way the data is collected in urban versus rural. That may also be another reason. And the media also plays a major role, because media is concentrating on urban cities, like large cities like Bangalore and Mysore, and there's not much media attention in the rural community. So what we see is what we're seeing in the media, which is kind of skewed in a way.
Thank you, doctor.
Thank you, ma'am.
have a question,
So,
Doctor, if you don't mind. Thank you very much for this compilation of very crisp and very important information at this time of the world. Just want to ask, like, very skeptical about AstraZeneca, especially like, having few cases over here where people have had, the stroke and there's been fatal as well, like few cases. And Kiran is supposed to actually take AstraZeneca, but he's been postponing because, like, we're really not too comfortable after hearing those. So what's your advice on this?
So all the vaccines that are out in the market are safe. There are some adverse events, like you just mentioned, but the number of those are very, 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 very rare. Like the numbers that CDC, Centers for Disease Control and Prevention, is posting, they say is 7 cases of these thrombotic events for 10 lakh people who get the vaccine. So if you take that kind of statistics, the chances of coming down with those kind of severe illness is really, 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 really low. But the chances of coming down with the disease of COVID is much, much, much higher. So if you're hesitant to get Covishield or AstraZeneca product, you've got other alternative vaccines out in the market. So I would personally not hesitate to get Covishield or AstraZeneca product, because in fact, many of my family members in Bangalore and other parts of India have received Covishield or AstraZeneca, and it's safe. I would not hesitate to get the vaccine. Again, the numbers are really, really very rare. So given the rarity of those side effects that you, the problem we have right now is the media really focuses on those rare events. That's how they can get their TRP rating high. But that's not what's happening regularly. So the percentage of rare events are really, really low. So please do not concentrate on those rare events. Look at all the positive things that are coming out from vaccination, and please go ahead and get the vaccine.
Pfizer is our second option. So is there any, like, how do you compare, like, it's better off taking Pfizer compared to AstraZeneca, having, at least we don't have this fear?
So like I discussed before, I would really not compare vaccines right now, because there's not any good way of comparing the two vaccines. One is a vector-based vaccine, and the one is an mRNA-based vaccine. I would not recommend comparing the two vaccines. They're both effective vaccine. They're both deemed to be safe. Like if you compare it, I mean, if you look at Pfizer, they do have some side effects. I mean, like right now, in fact, there'll be a publication coming out pretty soon from our own branch that I work with about myocarditis, inflammation of your heart. I mean, but that's again a very, very, very rare event that would happen. So any medicine or any vaccine that we can take have some side effects, but those are very significantly small. So whether you take Pfizer or either you take AstraZeneca product, I would really not worry about it. They're all safe vaccines. Millions of people have taken those vaccines and have done well. So I would not really focus on those rare, I mean, really very rare events and stress about it.
So we have one more question.
Sure.
Can rheumatoid arthritis patients take vaccination?
Yes, rheumatoid arthritis patients can take the vaccine. The one thing I would like to caution is make sure, especially if they're taking some of those immunosuppressive drugs, then they need to stop that for a couple of days before they can take the vaccine, because when you're on immunosuppressive drugs and you get the vaccine, your response to the vaccination is not as good as you want it to be. In some situations, you cannot stop those medicines, but you'll have to deal with having lower effectiveness from the vaccine. But if you can pause for temporarily between the medication, like your medication you're taking for rheumatoid arthritis, you can definitely get the vaccine, no hesitation at all.
I have a question. How long you will be protected after taking the second dose?
Okay, so this recent studies that we have learned is, as of now, they say at least for nine months to a year, because the studies that were done, at least on people who were part of the trials, start like in June, July last year, they had seemed to have a good protection from the vaccine. So as of now, the data availability is only to indicate that the vaccine at least has 9 months to a year protection, because we don't know, because we've not been there yet about how long this vaccine provides protection. So as of now, at least to a year is what they are projecting. There are some discussions going on among the scientific community where they're thinking about having a booster dosing maybe required. That is to come in the future, but right now they at least are assuring that the vaccines keep protection at least 9 months to a year, because that's how long we have data collected. We don't. It may have more, but right now the data that is available in the scientific community is only lasting about a year.
So one more question.
Sure, ma'am.
Doctor, is there any adverse effect on taking two different vaccines, like dose 1 Covishield and dose 2 Covaxin or Pfizer?
This question is coming up a lot. Preferably, we would like people to get the same vaccine, the same brand of vaccine that they got for the first dose. But when circumstances are different, then they may switch. Some of the recent studies or literature that's out in the scientific community says they can take it, but some scientists are saying that there can be some the side effects can be on the higher side, in the sense they may have experience a little bit more side effects, like more body ache and fever kind of thing, but they can. And again, one thing I would like to stress to people is not to compare efficacy of vaccines that are marketed by the manufacturers and change the vaccine for that reason. Please don't look at the efficacy projected by the manufacturers and take the vaccine, because the efficacy that has been projected by the manufacturers and the actual efficacy of the vaccine is very different, especially under the current situation in India. The efficacy of those vaccines may be much lower than what was projected initially when the studies were done. So don't just change vaccines just because of what is being marketed. If you don't have an option, when you don't have supply, that means that's a different story. But if you have the supply, I would recommend people staying with the same vaccine, because the efficacy of the same vaccine when you have 2 doses is much better. And we don't have much studies to say when we mix match these vaccines, we really don't know what their efficacy or effectiveness is.
One more question I have, sir.
Sure, sir.
Sir, if the person undergone any surgery, the major surgery like brain surgery or heart surgery, is there any adverse effect on the person who takes a vaccination, sir?
No. The only thing I would request in that kind of situation is at least wait for about 6 to 8 weeks after that kind of major surgery, because especially after those kind of major surgeries, the body is yet kind of recalibrating, or the immune system is kind of improving. In that situation, vaccination may not get much benefit. The person may not get much benefit from the vaccination. So at least wait for about 4 to 6 to 8 weeks after they've had those kind of major procedures or major hospitalizations to get the vaccine, to get much benefit from the vaccine.
Thank you, sir.
Thank you.
Are there any more questions?
Good evening, doctor. I have a question. After the vaccination,
Ma'am, could you be a little bit louder?
After vaccination, what precautions we have to take? Generally, people say after the vaccination, you should not take any anesthesia kind of thing that will cause side effects like that. So many messages are coming. So we want to know what precautions we have to take and how long we.
Okay.
Thank you.
In fact, I got the same WhatsApp message just 2 days ago. People got anesthesia at a dentist and died.
Yes.
No, please don't fall for those messages. There is not any kind of contraindication with any kind of anesthetic. Please don't fall for those kind of messages. The only precautions I would take from after any vaccination is to make sure that you're being hydrated, and if you have any minimum side effects, you can take Dolo or Crocin to help those minimal side effects, but that usually kind of wanes off within 48 to 72 hours. Other than that, I at least do not know of any like information that is being shared in our WhatsApp universities. So please do not fall for those kind of misinformation.
Thank you, Doctor.
Sir, I have a question.
Sure, sir.
Yeah, sir, what is the recurrence rate you are seeing among COVID patients? I think, already they have been affected by COVID and recovered. Then what is the recurrence rate? Like any data is there on that?
I'm not sure what the data is in India. In the US, it's been very, very rare. I don't have the numbers right in front of me, but the numbers are really, really low. But I don't know the current data of recurrence in India. I'm sorry, I don't have that specific numbers, but at least with what I know that's happened in the US, the numbers are really, really small. So I would think the same thing would happen in Indian environment as well, and the numbers I would think would be really low.
Yeah, sir, actually, alternatively, my question is like if we are seeing so many variants are there in COVID. Now, if a person gets affected by a particular variant and he successfully gets recovered, is he immune to all other variants, or he is immune to one specific variant from which he was infected?
So the immune system is pretty smart. So there's what we call as cross protection. So even though there's some change, or we say mutation, alteration, but most of our immune system is smart enough to recognize those. They may not be able to precisely recognize those minor variations, but our immune system is good enough to kind of combat the situation. So if you get exposed to a different variant, your immune system is good enough to manage that situation. So you like if you get exposed to different variant, you may have the illness, but it will be really mild compared to the earlier situation when you were in. So yes, it's not that you may not come down with the illness, but even if you come down, just like the vaccination, right? I mean, the vaccine right now may not be pretty adaptable to all the different variants that are in circulation, but it's good enough to give you protection based on the structural proteins, the spike proteins that are used in developing the vaccine, which stimulates the development of antibodies. So your antibodies in your body will kind of address those variants. Hope I answered your question.
Thank you very much, sir.
Yeah.
It looks like I have a question on the chat.
Yeah.
Okay, so let me read. Okay, after first dosage of vaccination, if a person is affected by COVID, then that person should take the second dose. Yes, the person should take second dose of vaccination, but they would recommend a gap of about 8 to 12 weeks after they recover from the illness. So same rule applies. So say you got the first dose of vaccination, but then the person got COVID disease. So the second dose would be recommended about 8 to 12 weeks after the recovery from the COVID. The same rules applies even there. And we would yet recommend them to get the vaccine, the second dose of the vaccine.
Yeah. So if that is it, shall we go for the concluding part of the session? Yeah. Aniket? Okay. Thank you, sir. It was truly informative session, and we thank for alerting us about do's and don'ts regarding COVID, which is very, very important at this hour. Right from wearing mask, the right approach of wearing it, maintaining social distancing were explained very effectively. The vaccines, its development phases, approval was very much informative, sir. The efficacy table you projected helped us a lot. And the fact you repeatedly told not to compare the vaccines, it was really good, sir. So the expectations, myths, facts were explained very well. And as you projected the oath, it really gave us positive attitude and motivated us to be COVID negative. And you answered all the questions so patiently, sir. Thanks a lot. Lot of questions in our minds have been solved and you answered it very politely and soothingly, sir. Thank you. Thanks a lot.
Thank you so much. Again, thanks to all of you for listening and giving me an opportunity. I would especially thank Dr. Bindu Thomas, who in fact invited me for this program. And again, thank you all for listening. And again, if there's any question or concerns, feel free to reach out to me, and I'll do anything I could in my abilities. Again, thank you all so much.
I think we have a small appreciation to you, sir.
Ma'am, thank you.
I don't know whether I can share it.
Thank you, doctor.
Thank you, ma'am. Thank you so much again.
Thank you, sir.
Thank you, ma'am. Thank you, sir.
Thank you, sir. Thank you very much.
Yeah, thank you, sir. Thank you.
Thank you.
A small appreciation to you, sir, from all our side. Thank you, sir.
Thank you, ma'am.
So can we leave the meeting, sir?
Yes, ma'am.
Yeah.
Do I need to do anything specifically before I leave the meeting, or am I good to leave? So. Okay, thank you.
So any questions, I'll just collect it and pass it on.
Sure, ma'am. Yeah, I'll definitely reply to any questions that you have received. Yes, ma'am. Thank you.
Okay.
Thank you so much. Thank you so much.
Thank you, Sri. Still waiting. Thank you, Bindu here.
Thanks, Bindu. Thanks a lot. Thank you so much for inviting me for this
My God,
presentation.
Sri, it was so useful. I'm still getting a lot of feedback from my colleagues saying that it was so clear for them. And I mean, they got a lot of their doubts clarified. So thanks a lot, Sri, for taking out time.
No problem at all. Thanks again for inviting and coordinating all this effort. I mean, putting this program is not a joke. And thanks for all those students out there who really helped you in, putting out this.
Yeah. Yeah, my colleagues and friends in the other institutes are also here, and many of them joined across the state.
Thank you. Thanks so much for this opportunity.
Yeah. Bye, Sri. Take care.
Bye.
Yeah,
You too.
bye.
Thank you. Bye.
Yeah, thank you. Bye.